Hello, this is Mike Gallagher. We are at live, the World of Wellness, formerly James Weiner Doctor Clinic. We are going to be discussing all different aspects of pain and inflammation, natural remedies that we can do. I'm your host today. I'd love to talk to you about this. We deal with all different types of health issues here at the clinic. Come on down. We have all kinds of great stuff going on, samples, free gift bags, all kinds of crazy specials. So come on down. We'd love for you to be there. Free food. It's just a great environment down here at the World of Wellness. So please, if you get a chance this week, we'd love to talk to you. Okay? So today, as I said, my name is Mike Gallagher. I'm a certified lifestyle educator. I've been in the industry over 28 years. I work with all different types of practices and healthcare practitioners, but I'm here this week helping answer questions and and do these different type of talks. So we're just all about the education, and this is a big topic today, folks. Pain, inflammation. We know a lot of people suffering. A lot of people turn to the medication route. First of all, we are not making any claims. We just want to emphasize that. We're just going to show you some of the ingredients of the formulas, how they work, some of the research behind them, and how it fits, giving you the concepts where everything is when it comes to different types of pain and joint pain, especially. But if you're on a medication, we're not telling you to get off. You have to work with your prescribing physician. The whole idea, though, is being the nutrition is a bridge, working with your prescribing physician, and hopefully your condition improves so that he can help lower your dosage to hopefully none at all. And we've helped thousands of people with this through the years, and hopefully if you're listening, or if you have somebody right now, in family member, friend, neighbor, who is suffering with pain and is concerned or sick of the side effects from the pain meds, or maybe not even aware of the dangers of the pain meds, this is something that you should really be on the radar. So this is a consumer health alert, folks. This is coming right off our website, nutritionalfrontiers.com, under the alert section. So if we can, there we go. There it is up on the screen. So it's all the dangers of over-the-counter pain meds. And folks, I just want to emphasize, this is not me saying it. It's not Mike Gallagher. It's not Nutritional Frontiers. This is the most prestigious medical journals in the world that all medical doctors refer to is stating this. And so this goes back to 1998 on the dangers of over-the-counter pain meds. So people think it's safe just because it's over-the-counter, and that is not the case, folks. So we're not even talking Oxycontin or any other serious narcotic type of pain drug. We're just talking stuff, Tylenol, ibuprofen, things like this. That class of drugs is called your NSAIDs, non-steroidal anti-inflammatory drugs. And back in 1998, the American Journal of Medicine said that over 107,000 patients are hospitalized annually due to GI complications, mostly GI bleeding and things like this. And this is a conservative estimation there, right? So over 100,000 people hospitalized. And by the way, this is taking it at proper dosage. This is not overdosing. And then here's the scary part, folks. Over 16,500 deaths each year from taking the NSAID. Okay? Now, occasionally you might hear this in the news. I can remember a few years ago, a couple famous basketball players, Sean Elliott, Alonzo Mourning, they're Hall of Famers, all pros, that they actually had to retire because they were taking so many NSAIDs that their kidney started to give, right? And so this makes news. And you see a lot of athletes in the same situation. It makes news for a day or two, and then again, it quickly gets swept under the carpet. So first of all, let's continue down this. All right, so that was 98. A year later, June 1999, New England Journal of Medicine said something very similar. Again, same statistic. It's estimated conservatively 16,500 deaths occurring among patients. This figure is similar to the number of deaths from the immune deficiency syndrome, but more deaths than any of these other kind of issues. Myelomas, asthma, cervical cancer, Hodgkin's disease. The toxic effects, the GI toxics effects would constitute the 15th most common cause of death in the US, right? But, oops, just lost that. Phil, I just actually hit the wrong button there. There we go. Sorry about that, folks. Little technical area. All right. So if the deaths were GI toxic from the NSAIDs were separated, again, 15th most common cause of death in the US, but it remains a silent epidemic. Most physicians, they might know a little bit about this, but they don't know anything else to do, right? So it continues down the medical merry-go-round out there, okay? So these are just over-the-counter. We just want to emphasize that, okay? If a person were to read the insert of these over-the-counter NSAIDs, most of them say do not take for more than 3 days, 72 hours consecutively. And we know most people are on these for months and years. And again, they don't know any other means. All right, so the first part of this is just becoming aware of this. You can email this to anybody, you can print it off for anybody who's concerned, and they should be, right? There are a lot of other healthier alternatives than taking these NSAIDs. So that is first and foremost that we want people to be aware of. So let's talk about some of them, okay? So we're just gonna go through the list here. Now, when I'm making suggestions and recommendations, it's just based on what I've seen clinically through the years as far as typical dosage. Sometimes we need to be more aggressive if we are working, the more pain you're in. So we just want to emphasize that. Again, temporary is the key word, okay? So let's just start with Turmeric Plus. So turmeric has been in the news a lot in the last couple years. Again, it is an herb, it's a spice from India. Again, has many different benefits. So if we actually scroll down to the bottom here, we're listing all the amazing things that turmeric can do, right? Fights free radical damage. That's one way how we age, by the way. Helps with gallbladder, helps with digestion, helps with cholesterol, helps with circulation, helps with joint support, helps, right? Which we're talking about right now. Pain issues, right? Helps with GI, intestinal flora, helps with absorption metabolism effect, and helps strengthen your immune system. Again, we know a lot of people are interested in their immune right now, okay? So, many different benefits. In fact, we could go on, but you get the gist of it. It helps on so many things, but one of the main things that it helps is reduces all inflammation, all pain. Now, so turmeric is the herb, curcumin is the actual extract, okay? So when we're looking at the supplemental facts, instead of looking at just turmeric, you want to look at curcumin, right? So we're using a very unique, patented, and trademarked form of curcumin in the Turmeric Plus now, okay? So here it is a little bit more detail, okay? It's called curcumin is the trademark name of this, and in studies, it's been shown to be 46% more absorbable than any other regular turmeric or curcumin on the market, okay? It doesn't interfere with any issues as far as medications other than prescription blood thinners, okay? So any herb, any good fat, if you're on a prescription blood thinner, you really need to consult your prescribing physician. But every other medication, completely safe, just taken an hour apart. So here is the research, folks, right here. So this is your standardized curcumin that they sell everywhere, okay? Mass marketed, all right? And then you see some other ones out there on the market that are slightly better. But then you take a look at ours, folks. What we're using here, the curcumin, as we said, statistically 46% more absorbable than any of your other commercial formulas, okay? That's one unique thing about this. The other thing that we want to emphasize is that most of the studies done on turmeric or curcumin on the market, they were done in India. And that population already eats a tremendous amount of turmeric in their diet. So how much turmeric do they really need if they're already eating it? Now, where were the studies done with this? The United States, who eat very little turmeric in their diet. Okay, so again, that is another behind the scenes that most people are not aware of in the world of supplementation, is where they're actually doing the research. And that does make a difference. In addition to that, we added bioperine. Okay, bioperine is a trademark black pepper form. And the studies here show that it actually enhances the absorption of turmeric, or curcumin in this case. So let me go back to that graph here 1 second. Right? So when you combine the curcumin with bioperine, you get much greater absorption. And that's why we added the two together. Okay? So if you're in pain and you just want to use Turmeric Plus, right? Look at the suggested use, folks, right? That is maintenance dose. That is not if you're in pain. If you're in pain, you got to take a lot higher. Again, the key word is temporary loading dose. And body weight does play a role, but generally speaking, we're recommending 4 to 8 capsules with food initially if you're just using this formula. Now again, if you do great with 2, great. If you want to start slow and build up to that level, no problem. But we just want people to be aware of, if you're in a lot of pain and you're used to taking an NSAID, then you need to be more aggressive to get that pain and inflammation under control, and then we can back down, okay? So if you can just start right there. Now, to me though, if we want to move up the ladder, so to speak, the next option would be Inflame. And when we're going through all these options, you know, I can make recommendations, of course, here. That's what they are. They're a recommendation. I always suggest that you come in and meet with Jeff Nisnik. He can actually do muscle testing, kinesiology testing on you. He can tell you exactly what formula is best for you, what your body is working the best. Okay, so we just always want to emphasize that as well. Always good to work with some type of certified healthcare practitioner, okay? And I've known Jeff for many years. He's fantastic. He's helped thousands of people, and he can really fine-tune your program, nutritional program. Okay, so next let's talk about Inflame. So Inflame, again, obviously what we're talking about here today, pain, inflammation. It has the curcumin in there, which we talked about, that's in the turmeric, okay, the Turmeric Plus. But it has a lot of other ingredients in here, folks. All right, so it has holy basil, it has ginger, it has decaffeinated green tea, it has boswellia, it has bromelain, and it has skullcap, which is very unique there as well. You don't typically see that in a lot of anti-inflammatory pain formulas. It also has some antioxidants in there, resveratrol, some berberine in there as well, okay? But where I think this works the best is for stress, pain, and inflammation, okay? So think fibromyalgia, okay? Or if you are strict vegetarian, okay, then this would be the better choice. So it just takes Turmeric Plus to another level with these added ingredients that we're using, okay? But why this works best for stress-related pain, holy basil, right? And I always say holy basil, holy moly, is fantastic herb, right? It's been used for thousands of years. All different types of research, but stress related. But it also can even help with asthma and high blood sugar. So that is one of the ways that I position the Inflame over some of the other formulas. Stress-related pain inflammation. So that is you, then this is for you, okay? Then let's take a next step up, Xflame. So this is one of our flagship formulas. We've had this for many years. When the company was just developing in the initial days, again, we knew we had to be different, we had to be unique, we had to use ingredients that we've never seen out there in the marketplace. And that was 14 years ago, folks, by the way. And so we researched this over and over, and we came out with this formula, Xflame. And we really set the bar extremely high in the world of natural pain and anti-inflammatories. We've had thousands of testimonials through the years. Many, many, many different doctors have used this through the years. Again, focusing on what we're talking about, reducing pain and swelling, helping mobility, and it can even help with boosting your immune, okay? So when we take a look at this formula, you see the turmeric in there, you see the boswellia, right? But we also added quercetin in this, rutin in this, ginger in this, a little bit of cayenne in this. But the really unique thing with this one, separates it from the Turmeric Plus, is these two patented trademarked ingredients. So it has DMG, dimethylglycine, one of my favorites of all time. It does many different things. On its own, it had a US patent to reduce and treat inflammation. Okay, I'll say that one more time. We could make a drug claim with DMG. Now the patent ran out, so we have to use it in past tense, but there's all kinds of studies with this if you take the right amount, okay? It also acts as a methylizer. It will help with the absorption of all these other ingredients. It'll make it work faster, which is what we want, okay? Now, of course, we do sell DMG by itself, but put in a formula like this, it makes the other ingredients work even better, okay? But the really unique thing about this is this ingredient, creselazine. So creselazine is a patented trademarked ingredient. It's a combination of both omega fats and creatine, a pH buffered form of creatine. And there's numerous studies that show exactly helps reduce inflammation, pain, stiffness, swelling. Now, it's really interesting here, folks, at the clinic, we have the unique capabilities of test marketing any ingredient, any formula here, okay? And so when we looked at the research on just this one ingredient, it was phenomenal. It was unbelievable. 80% of the people who were taking this compared to an NSAID said it was better, just the same, if not better, okay, than an NSAID, just that one ingredient. And so we actually test marketed this ingredient 14 years ago here. And we tested on an even larger case study than what was in the test trials. And we got exactly the same results. And so that was the aha moment that we said, listen, we need to put this in a formula. And so that's what we decided to do with Dr. Weiner at the time and Jamie Dorley leadership. They decided to put this in this formula, and voila, we have this amazing formula, okay? So just a little background. You can buy these all individual, or you put it together in this formula. It's going to save you a lot of money. And again, we call that synergy, working together to get even faster results, okay? So we have the capsule option, or if you prefer, a powder option, okay? They're both exactly the same. But the key with this formula is the dosage, right? So let's take a look at what we say on the bottle, on the text sheet. It says take 4 caps 1 to 3 times daily. So that's a pretty wide flexibility there, dosing, all right? So here's what I've seen work the best. If you are in pain, then we recommend a temporary loading dose of 12 capsules a day. For breakfast, for lunch, and for dinner, preferably. You always want to take it with food, okay? And that would be the same with the Turmeric Plus, okay? If you want to start out slow, that's fine, and build up. if you're super sensitive to medications or vitamins, you can start out slow, no problem. But typically, clinically speaking, we get the best results starting with that temporary loading dose of 12 a day. Once that pain inflammation is under control, and we usually will know in one bottle, we usually have seen cases 3 to 5 days, generally speaking, but everybody's different. Your severity is different, your tolerance of pain is different. So, but whenever you feel that pain relief, then we back it down to 4 caps a day, 2 breakfast, 2 dinner. Okay? So that's the key with this, is taking the right dosage. When we have people who come in and say, oh, I tried, it didn't really work, we say, how many did you take? Oh, 2. Oh, I did 1. I'm like, well, you have to take a lot. You have to take the right amount, folks, for this to work. So this is where we see the best results. So keep that in mind. Now, if you prefer powders, liquids, then we have that option, okay? 1 scoop would equal 4 capsules. So if you are using the powder, then it would be the loading dose 3 scoops a day, right? Breakfast, lunch, and dinner. Once you feel the pain relief, then we back it down to 1 scoop, okay? Either one work great, whichever you prefer. That's why we have both options, okay? Very interesting enough, though, for upper respiratory issues, asthma, which flares up this time of year with the warmer weather, or even allergies. We're using a lot of bioflavonoids in this, which also can help with asthma. Okay, so before we had some of our other formulas like Aramax and NAC, we just had Xflame, and we had people that it not only helped with our lung issues, but also other types of pain inflammation that this will help with. Okay, so that has always been my number one for structural type of pain, joint pain, right? Hip pain, knee pain, cartilage, those kind of issues. However, we have come out with something new in the last few months, and this is called SPM. So, a couple really unique things about SPM. Already this week, we've had Dr. Bob Rakowski on talking about it, Todd Parker, who is a guru as far as omegas and SPM, talk about this. But I can really see that I've never seen anything that works as quickly as SPM, right? I thought I saw it a lot with CBD, and CBD has helped a lot of people. We have a CBD cream, transdermal cream, that can help people within minutes. But again, typically it's temporary. But the SPM is doing something that nothing else can do, okay? So Dr. Bob, if people have a chance to go back and listen to his stress reset from Saturday at the 15-minute mark, he does explain a little bit about this, okay? But just here it is in a nutshell. We've known about omegas since the 60s, helping with all different types of inflammatory issues, and goes through 13 different pathways, and it can help with reducing heart attack and stroke and cancer, right, if you take the right amount, okay, and helps with all different types of pain inflammation. But SPMs was discovered by Dr. Sirhan from Harvard, and he dug deeper on the omegas. And what he found is he injected omegas into lab rats, and what he found is that they create these, what we know now as these resolving mediators. And the healthier you are, the more you had in your system, and the unhealthy you had, or the sicker you were, you made less of these. And so he then for the next 15, 20 years, he worked on it with humans. And he developed a way to break it down from omegas to these SPMs. And he was nominated for a Nobel Prize with these SPMs. So this is a brand new discovery, folks, in the world of nutrition. We're calling them SPMs because they're called specialized pro-resolving mediators, right? They're broken down from your omegas, more downstream. Okay, there's actually a 3-step process that gets us to this point from omegas. You can't take regular fish oil, enough of it to make a difference. There's only trace amounts in omegas, so you have to use it in this format, this setting, these SPMs. They are also naturally found in every mammal, and even new mothers make abundant amounts in their breast milk. So this is completely safe for pregnant women, for nursing women, if you're having any type of pain inflammatory issue, which is great, which is another great benefit, because normally we can't recommend too many things, but this is one of them. And there's literally over 1,500 PubMed studies on the benefits of SPMs now. So all you have to go to PubMed, which stands for Published Medical Studies, and you type in pro-resolving mediators studies, and you will see all these different ones, including 165 for cancer, all different aspects of pain, inflammation, and even I found one on Lou Gehrig syndrome, ALS, because I had a doctor who asked me, had a patient with the ALS, and I said, you know what, I'm going to do some research on this with the SPMs, and there's actually one on that. It's the only supplement I've ever seen, by the way, with research for Lou Gehrig's, which is really unique. So any type of inflammatory issue, so pain, brain, heart, eyes, skin, hair, hormones, immune, SPMs, okay? SPMs will help if you're taking the right amount, right? So the third paragraph here on the text sheet kind of breaks it down a little bit more in detail. They do not block the vital initial response to trauma like drugs do. They block the pain, but then again, they're not really fixing anything. They're temporary band-aids, but they prevent excessive inflammation, promote tissue homeostasis by controlling the duration and magnitude of inflammation. Okay? They're called resolving mediators because of their role in facilitating natural resolution of the inflammatory response. Now, we can get more technical here, folks. Okay, you can break it down into 4 subcategories: resolvins, lipoxins, protectants, and maresins. But SPMs, think of that's the mother. And then these are all byproducts, subcategories, and each one has a special skill set. So one is best for pain, one is best for the heart, cardiovascular, one is best for the eyes, right? Now the cool thing is we're using all of them in our formula, but that's how much the research is getting into as far as breaking these down. The other really unique thing about this is the immune benefits, okay? So it actually helps, inhibits the production of the inflammatory mediators, and it helps regulate white blood cells. So there actually is PubMed studies on this helping with COVID, and we've had cases with lingering issues, the long hauler syndrome, especially for lung. If they still have that nagging cough, we have many cases now that we would recommend this, that it's helped for. So if you know anybody in that situation, usually within a week, we've seen great results with this as well. So it can even help with the toughest of the tough situations and cases out there, folks, is the key. And again, things I've never seen before in 28 years, I'm seeing with the SPMs. And it actually helps protect the organs and stimulates tissue regeneration. So we're going to talk about some other formulas here in a moment that also will help with this, but this is the starting process, okay? So all kinds of research. We mentioned just a few things here: pain scores, arthritis scores. It looks at all different types of blood markers. We mentioned here one, ESR, SED rates. There's also other ones out there as well that it looks at. C-reactive protein, that's another very famous marker. This SPMs has shown 40% reduction in studies, right? Helps with even GI problems, kidney problems, periodontal issues, asthma, again, the lung, as I was talking about, this will help with. Really any inflammatory issue, but here again is the key, right? Even though we produce these, right? Every mammal on the planet makes these, right? The ability to produce them may be compromised the heavier you are and the older you get. Or again, the sicker you are, right? So This is one reason why it takes a lot longer for older people to heal as quickly as younger people, is the reduction of these SPMs. So again, we're not anything foreign to the body. We're just simply adding more to jumpstart the healing process, okay? So let's take a look at the dosage. So this is how we have to write this up, right? So it's broken down into the EPA side, into the DHA side, and also DPA. DPA, so 3 different subcomponents from the omegas there that converts it into this process of these SPMs. It's not regular fish oil, but it is like fish oil on steroids, okay, or next generation fish oil. So other than prescription blood thinners, just like we mentioned with turmeric or any herb omegas, we would need permission from their PCP or cardiologist, okay? Other than that, it's completely safe to use with any medication, just an hour apart, which is the standard general rule of all medications and supplements, okay? Take it at least an hour apart. But the dosage that we have on the bottle, taking 2 a day, is the maintenance dose, not if you have pain, okay? So if you're in pain, especially structural type of pain, I always ask you now what, and again, this is just trial and error. So from we introduced this, and again, not only working here at the clinic, but other practices, if you're in pain on a scale 1 to 10, if it's 5 or higher, we get the best, fastest results recommending 6 a day, 2 breakfast, 2 lunch, 2 dinner, okay? If that pain is 4 or less, then we would recommend 4 a day, 2 breakfast, 2 dinner. We will know in 1 bottle if this works. We usually know in just a few days. But once that pain is 100% better, then we reduce it down to 2 a day. Okay? My first case with the SPMs, I just want to mention this, was an auto accident, okay, from 20 years ago, a female. And she was in pain and has been in pain for over 20 years. She's tried a bunch of different things. No supplements helped her. She did other therapies. Nothing helped her. And she was just in agony. And so she took 4 a day, and in 4 days, 50% better. 20 years, 4 days. And in 30 days, she was 100% better. Okay? So that was my first aha moment. I've had other amazing cases. We've had cases, motorcycle accidents, nothing's helped, neck and back pain. You notice this, and within days. We've had chiropractors who've never seen anything like this, helping with different type of inflammatory issues as well, okay? So majority people, this is the dosage that we've seen the best results. However, Dr. Bob Rakowski, last time we had a wellness week, he mentioned a very aggressive dosage that he's getting even better results with, okay? And so what he recommends, if you're in extreme pain, is 2 every hour, taking 2 every hour for 12 hours straight, okay? 2 every hour for 12 hours straight. So that's 24, folks, in that 12-hour period. But Dr. Bob is reporting back to us, he's actually using the words miraculous, and Dr. Bob has been practicing over 30 years. And we've never heard him say that with any other supplement ever in 30 years. So I recently had my first case who tried it locally. So here's the situation. As a chiropractor, one of my accounts, here I had a patient, a male in his 70s, classic arthritis, degenerative disc, and a pain scale was a 6, and he has been for years. Chiropractic wasn't helping, no supplements were helping, and he tried the 6 a day, the SPM. It didn't help. So then the chiropractor reached out to me and said, what do we do? I said, let's try the Rakowski protocol. let's try 2 every hour for 12 hours straight. So he did. And folks, in one day, he went from a 6 in pain to a 0 in one day. He called the office the next day, tears of joy, just unbelievable. Couldn't believe it, how much pain relief he felt. You know, since then, we've had other cases that have done this with just the same results. So again, sometimes we have to experiment. Everybody's different on the dosage. 4 to 6 usually works, but if it doesn't, it is safe to go with that higher dosage. 2 every hour for 12 hours straight, 24, okay? Now what? Okay, the now what is once the pain is under control, now we need to rebuild. So now we back it down to 2 a day until we finish the bottle, okay? At that point, I would recommend regular omega-3 fish oil, 2 a day, just as maintenance dose. But now it really depends on the type of pain inflammation we're talking about. So if it's more joint cartilage related, then we go with HA+. So back, classic arthritis, degenerative disc, knees, hips, all that, okay? So this is one of our original formulas, HA+. It's one of the top selling formulas still, 14 years later. It's helped thousands of people through the years. We have so many cases and testimonials, it's hard to keep track of them all. But this is the rebuild stage. So yes, this will help reduce inflammation, not as much as SPM or Xflame or Inflame or Turmeric, but it will help a little bit. But what it's really going to do is rebuild the cartilage over time. And typically, depending on the size of the body part, 1 to 2 months. So again, fingers, extremities, things like this, usually, you know, people notice this within 2 to 4 weeks. Hips, knees, back, things like this, obviously larger body parts, you know, typically 4 to 8 weeks, okay? You just have to be consistent with this, all right? Now, let's take a look at what's this. So let's take a look at the capsules first. So the main ingredient in this, folks, is BioCell collagen. So this is a patented trademark form of hyaluronic acid and chondroitin sulfate. There's actually many patents on this specific ingredient. And just a little brief history. Back in the 80s, glucosamine sulfate came out. And for about 50% of the population, is what the studies show, if you take the right amount, 1,500 milligrams, and for the right length of time, typically 8 to 12 weeks, that people will see a difference. But that still leaves 50% of the population that it doesn't. Then in the 90s, hyaluronic acid came out. So hyaluronic acid is a precursor to glucosamine. And it is a little more absorbable. It works statistically about 75% of the population. But that still leaves 25% that it doesn't. And why is that? Because it's a very large molecule. And for some, it's too large of a molecule for your body to break down and absorb. So this ingredient, this patented trademarked ingredient called BioCell collagen, and there is all the background on it, and there's just some of the patents, they're listed right on the text sheet, has been shown, if they figured out a way to break it down 600%, right? Reduce that molecule size 600%. And so therefore, statistically speaking, it works on 99% of the population. It is the most absorbable hyaluronic acid on the market. There's also studies on this, by the way, for skin. And taking 4 caps a day for 12 weeks significantly improved reducing wrinkles. Okay, so it's not going to just help with joints, it's going to help with skin as well. So we call that a positive side effect. Other benefits of this. We added additional MSM as well, which is another cofactor. So that's the plus side of it. So that's why you call it HA+, hyaluronic acid, plus you get the chondroitin, plus you get the glucosamine, plus you get the MSM. Okay? Now again, if we're just using HA Plus and you're in pain, we get the best clinical results with the temporary loading dose 6 a day. Okay? So break that up, 2 breakfast, 2 lunch, and dinner. Once that pain is better, or once the range of motion is improved, so you're not limping, there's no issues, then we back it down to 2 a day. Okay? Now, if you did any of those other anti-inflammatories first, turmeric, Inflame, Xflame, or SPM, hopefully the pain's reduced now, so you just need to take 2 a day. If you just go with HA Plus, it's a much longer process, folks. So we call it bundling. Bundling these together will give you faster, quicker results. And who doesn't want that, right? If you're in pain, it's miserable. Now, we do have a powder option if you are a vegetarian, okay? All right? We're using a very unique plant-based glucosamine in this, okay? Again, 1 scoop if you're not in pain, 3 scoops if you are in pain. Okay, so it's very similar to the Xflame powder. 3 scoops, 1 breakfast, 1 lunch, 1 dinner. If you're not in pain, or once the pain's reduced, down to 1 scoop. Whichever one you prefer, folks, we have both options. We understand vegetarians, your needs are different as well, so that's why we have the vegetarian formula there on the powder, which, by the way, is very unique in the industry. Okay, so that's for all joint cartilage type of issues. But what if it's something else? What if it's tendon ligament issues? What if it's shoulder injuries? What if it's more of those issues? So if that's the case, we have a separate formula, a different formula called GreenLip Muscle. So this is exactly what it says it is. It's mussels, concentrated mussels from New Zealand. So again, if you have a shellfish allergy, then I would not take this. Just go with the HA Plus aspect. But joints, ligaments, tendons. So think strains, sprains in knee and shoulders. Okay? So what's really unique about this is it actually has all these naturally occurring vitamins and supplements in one. And I've never seen any natural food product that actually has this. So it has amino acid, it has branched chain amino acids, it has minerals, it has your omegas, the good fats, it has glucosamine, it has chondroitin, it has in there, I got it. We're going to go back up here. It has hyaluronic acid as well, okay? But naturally occurring is in this food, okay? In this food, nothing like this. So if you have those type of issues, if you've had things that even as bad as torn rotator cuff, okay? We've had cases, testimonials of people who needed surgery. They started taking this, and on their own, working with their chiropractor or the therapist, taking this, they didn't need the surgery, folks, right? It actually healed torn rotator cuffs. We have testimonial after testimonial after testimonial, right? So again, there's different ways you can take this. What I've seen, if you have these issues or limited range of motion, I get the best results starting with 6 a day. 2 breakfast, 2 lunch, 2 dinner. Once that pain is under control, once you have 100% range of motion in your shoulders, then we back it down to 2 a day. Okay? But I was talking to a massage therapist earlier today, as a matter of fact. She personally had some issues. She took this. She said, this is amazing. This is incredible. There's a chiropractor I work with. He's had 6 different cases of torn rotator cuff cases that he's used this, and every time it's worked. Okay? So again, an orthopedic surgeon will say that's impossible. I say, well, then how did it happen 6 times? Interesting. Right? They're just not aware. They're just not aware. They know surgery, they therapy, they don't know about this, folks. So if that is you or someone you know, Give this a chance. We will know in one bottle for sure if this will help for you. Okay, so let's review. Turmeric, we can start there, just basic anti-inflammatory. Inflame takes turmeric to a whole nother level. And again, I feel it works best for stress-related pain and inflammation, things like fibromyalgia. Structural issues, Xflame will help if you take the right amount, which we get 12 a day of the caps or 3 scoops of the powder. But what I'm really leaning towards, folks, if you had to pick one, it would be SPM. It's going to work faster, quicker. The loading dose is just 6 a day for most cases, right? 4 to 6. Or if you have severe pain, you can do that. Even the Rukowski protocol, 24 in that 12-hour period. Then we need to do the rebuild, the GreenLip Muscle, tendon ligaments, strain sprained shoulders, or the HA Plus if it's more cartilage, back, knees, joints, things like this, okay? So that's the whole idea, giving you the concepts. We've helped so many people, I've lost count with these formulas through the years. If this is you and you're suffering, give this a chance, okay? Phil, any questions right now? All right, no questions. Any questions in the audience? Good? Okay, so my time is up. I appreciate this. Again, this is recorded. You can watch this again on YouTube or on our Nutrition Frontiers Facebook page. Again, share this, spread the word. Only trying to help people. All right, so live long and prosper.